our right hand to do what you do. Filter that.
My name is Carla Morales, Chair of the Tucson Hispanic Chamber of Commerce. March will mark the anniversary of when life changed for us all. The unprecedented pandemic impacted every aspect of our lives. Despite the challenges faced, we at the Chamber are grateful for the opportunity to work with our partners and our members. We are committed to learning and adapting in order to succeed. We invite you to engage in a series of roundtables where we will discuss what is the shape of economic recovery. Through collaborative work, we will connect, we will learn, and we'll put into action insights and ideas. For more information, please visit our website at www.tucsonhispanicchamber.org or call us at 520-620-0005. Together, we will shape Tucson's economic recovery.
Recovery is neither V, U, or L. It's actually a K-shaped recovery. For those of you that don't have awareness of it, the simple K-shaped recovery means that it's an unequal recovery. And the facts support it. We've remained in that state because of COVID. with the jobs picture for those sectors that were hardest hit. We will remain that way until COVID is substantially behind us. That means that the recovery in late 2021 is possible in a V shape once those jobs start coming back, but I really see the opportunity in 2022 for the economy to be fully on fire once all those jobs in the service sectors that were hardest hit come back to full employment. Here's the good news. The good news is that today there's substantial investment going into technology, new innovation, new products. There's a lot of growth in different sectors. And the second factor is that the stimulus will also help generate additional spend in the economy and help accelerate the jobs picture. So I'm very excited about what is happening here, but it is clearly, to me, a K-shaped economy.
The economies of Mexico and the United States are strong and are competitive, or where integration framework and economic integrations will allow the two countries to thrive together and to recover from all the social and economic effects of this world pandemic. So I am sure this recovery will be comprehensive and will be quite fast because of the hard-working societies that characterize Mexico and the United States.
This is Scott Odom. I'm the Chief Financial Officer at Vantage West Credit Union. And to me, the shape of this economic recovery, for credit unions anyway, is a U. We are not experiencing a lot of loan losses, which has been positive since there's been a lot of stimulus and we've taken measures to assist our members. But it's also not a good environment for us from a interest rate perspective. Having ultra low interest rates expected for a long period of time is a very challenging environment for a community banking institution. However, I would say overall the recovery in the economic environment has been a V shape with a dramatic improvement in GDP and unemployment since the depths of the worst part of the pandemic. And I think underneath that V is a lot of different letters for a lot of different people and businesses, from V to L to even a J shape for some that are actually improving throughout this time frame. Thanks.
Bad companies are destroyed by a crisis. Good companies survive a crisis, but great companies are defined by a crisis. The COVID-19 recovery will be K-shaped. Some companies will grow, while others will be left behind. Trade and investment will continue to flow in North America regardless. New players, women, SMEs, multinationals will emerge due to the USMCA, e-commerce, and technology. Only the right mindset will allow us to remain competitive, a mindset built on hope, resiliency, and innovation. As business leaders, we must be focused on creating value for our customers, our teams, and our community.
We invite you to participate in the Base Plus program. This program is brought to you by the Tucson Hispanic Chamber of Commerce, Millennium International, and Vibin. This is a 10-week course where we help businesses identify opportunities and establish systems of growth. This is a 10-week course that will take place every Tuesday and every Wednesday from 5:30 p.m. to 7 p.m. So if you're interested in participating and want to get resources and knowledge, please call 520-620-005 or visit the Tucson Hispanic Chamber of Commerce website.
What is the shape of V, a U, or an L? That's a great question. In business, it's cyclical. It goes up, it goes down. Well before the pandemic, it could be a W. So the real question is, what has changed? What is different about our customer patterns and habits? What is different about delivery of product? Asking those questions and learning from them can make a big difference on how we adapt and pivot during this time.
I think it's definitely going to be a K-shaped recovery where those with wealth accumulate more and the vast majority of Americans continue to struggle. 68 to 78% of Americans live paycheck to paycheck. Most people can't get access to affordable quality health care. And we have a tax system where, by the percentages, small businesses and individuals pay more than large corporations like Amazon, ExxonMobil, Walmart. So I think it's going to be a long recovery, and I question what we're even recovering back to.
El año 2020 fue una experiencia que nos cambió la vida a todos. A medida que la Cámara de Comercio Hispana de Tucson mira hacia el 2021, los invitamos a que se unen a nuestra conversación de mesas redondas, donde nos reuniremos a discutir lo que está sucediendo y cómo juntos podemos hacer avanzar a nuestra comunidad. Para más información, comuníquese con nosotros al tucsonhispanicchamber.org o llámenos al 520-620-0005. Gracias.
my name is Carla Morales, Chair of the Tucson Hispanic Chamber of Commerce. March will mark the anniversary of when life changed for us all. The unprecedented pandemic impacted every aspect of our lives. Despite the challenges faced, we at the Chamber are grateful for the opportunity to work with our partners and our members. We are committed to learning and adapting in order to succeed. We invite you to engage in a series of roundtables where we will discuss what is the shape of economic recovery. Through collaborative work, we will connect, we will learn, and we'll put into action insights and ideas. For more information, please visit our website at www.tucsonhispanicchamber.org or call us at 520-620-0005. Together, we will shape Tucson's economic recovery.
The recovery is neither V, U, or L. It's actually a K-shaped recovery. For those of you that don't have awareness of it, the simple K-shaped recovery means that it's an unequal recovery. And the facts support it. We've remained in that state because of COVID, with the jobs picture for those sectors that were hardest hit. We will remain that way until COVID is substantially behind us. That means that the recovery in late 2021 is possible in a V shape once those jobs start coming back, but I really see the opportunity in 2022 for the economy to be fully on fire once all those jobs in the service sectors that were hardest hit come back to full employment. Here's the good news. The good news is that today there's substantial investment going into technology, new innovation, new products. There's a lot of growth in different sectors. And the second factor is that the stimulus will also help generate additional spend in the economy and help accelerate the jobs picture. So I'm very excited about what is happening here, but it is clearly, to me, a K-shaped economy.
The economies of Mexico and the United States are strong and are competitive, or where integration framework and economic integrations will allow the two countries to thrive together and to recover from all the social and economic effects of this world pandemic. So I am sure this recovery will be comprehensive and will be quite fast because of the hard-working societies that characterize Mexico and the United States.
This is Scott Odom. I'm the Chief Financial Officer at Vantage West Credit Union. And to me, the shape of this economic recovery, for credit unions anyway, is a U. We are not experiencing a lot of loan losses, which has been positive since there's been a lot of stimulus and we've taken measures to assist our members. But it's also not a good environment for us from a interest rate perspective. Having ultra low interest rates expected for a long period of time is a very challenging environment for a community banking institution. However, I would say overall the recovery in the economic environment has been a V shape with a dramatic improvement in GDP and unemployment since the depths of the worst part of the pandemic. And I think underneath that V is a lot of different letters for a lot of different people and businesses, from V to L to even a J shape for some that are actually improving throughout this time frame. Thanks.
Bad companies are destroyed by a crisis. Good companies survive a crisis, but great companies are defined by a crisis. The COVID-19 recovery will be K-shaped. Some companies will grow, while others will be left behind. Trade and investment will continue to flow in North America regardless. New players, women, SMEs, multinationals will emerge due to the USMCA, e-commerce, and technology. Only the right mindset will allow us to remain competitive, a mindset built on hope, resiliency, and innovation. As business leaders, we must be focused on creating value for our customers, our teams, and our community.
We invite you to participate in the Base Plus program. This program is brought to you by the Tucson Hispanic Chamber of Commerce, Millennium International, and Vibe. This is a 10-week course where we help businesses identify opportunities and establish systems of growth. They're every Tuesday and every Wednesday from 5:30 p.m. to 7 p.m. So if you're interested in participating and want to get resources and knowledge, please call 520-620-005 or visit the Tucson Hispanic Chamber of Commerce website.
What is the shape of V, a U, or an L? That's a great question. In business, it's cyclical. It goes up, it goes down. Well before the pandemic, it could be a W. So the real question is, what has changed? What is different about our customer patterns and habits? What is different about delivery of product? Asking those questions and learning from them can make a big difference on how we adapt and pivot during this time.
I think it's definitely going to be a K-shaped recovery where those with wealth accumulate more and the vast majority of Americans continue to struggle. 68 to 78% of Americans live paycheck to paycheck. Most people can't get access to affordable quality health care. And we have a tax system where, by the percentages, small businesses and individuals pay more than large corporations like Amazon, ExxonMobil, Walmart. So I think it's going to be a long recovery, and I question what we're even recovering back to.
El año 2020 fue una experiencia que nos cambió la vida a todos. A medida que la Cámara de Comercio Hispana de Tucson mira hacia el 2021, los invitamos a que se unen a nuestra conversación de mesas redondas, donde nos reuniremos a discutir lo que está sucediendo y cómo juntos podemos hacer avanzar a nuestra comunidad. Para más información, comuníquese con nosotros al tucsonhispanicchamber.org o llámenos al 500.
Carla Morales, Chair of the Tucson Hispanic Chamber of Commerce. March will mark the anniversary of when life changed for us all. The unprecedented pandemic impacted every aspect of our lives. Despite the challenges faced, we at the Chamber are grateful for the opportunity to work with our partners and our members. We are committed to learning and adapting in order to succeed. We invite you to engage in a series of roundtables where we will discuss what is the shape of economic recovery. Through collaborative work, we will connect, we will learn, and we'll put into action insights and ideas. For more information, please visit our website at www.tucsonhispanicchamber.org or call us at 520-620-0005. Together, we will shape Tucson's economic recovery.
Recovery is neither V, U, or L. It's actually a K-shaped recovery. For those of you that don't have awareness of it, the simple K-shaped recovery means that it's an unequal recovery. And the facts support it. We've remained in that state because of COVID, with the jobs picture for those sectors that were hardest hit. We will remain that way until COVID is substantially behind us. That means that the recovery in late 2021 is possible in a V shape once those jobs start coming back, but I really see the opportunity in 2022 for the economy to be fully on fire once all those jobs in the service sectors that were hardest hit come back to full employment. Here's the good news. The good news is that today there's substantial investment going into technology, new innovation, new products. There's a lot of growth in different sectors. And the second factor is that the stimulus will also help generate additional spend in the economy and help accelerate the jobs picture. So I'm very excited about what is happening here, but it's clearly, to me, a K-shaped economy.
The economies of Mexico and the United States are strong and are competitive, or where integration framework and economic integrations will allow the two countries to thrive together and to recover from all the social and economic effects of this world pandemic. So I am sure this recovery will be comprehensive and will be quite fast because of the hard-working societies that characterize Mexico and the United States.
This is Scott Odom. I'm the Chief Financial Officer at Vantage West Credit Union. And to me, the shape of this economic recovery, for credit unions anyway, is a U. We are not experiencing a lot of loan losses, which has been positive since there's been a lot of stimulus and we've taken measures to assist our members. But it's also not a good environment for us from a interest rate perspective. Having ultra low interest rates expected for a long period of time is a very challenging environment for a community banking institution. However, I would say overall the recovery in the economic environment has been a V shape with a dramatic improvement in GDP and unemployment since the depths of the worst part of the pandemic. And I think underneath that V is a lot of different letters for a lot of different people and businesses, from V to L to even a J shape for some that are actually improving throughout this time frame. Thanks.
companies are destroyed by a crisis. Good companies survive a crisis, but great companies are defined by a crisis. The COVID-19 recovery will be K-shaped. Some companies will grow, while others will be left behind. Trade and investment will continue to flow in North America regardless. New players, women, SMEs, multinationals will emerge due to the USMCA, e-commerce, and technology. Only the right mindset will allow us to remain competitive, a mindset built on hope, resiliency,
Good morning, everyone. Can you hear me? Can you hear? Good morning. How is everyone? I'm so excited to see all of the faces live. Let's give a round of applause to Isabel and her team to put all this together. Well, my name is Erica Aguilar, the Vice Chairwoman of the Tucson Hispanic Chamber of Commerce. Thank you for joining us this morning at the THCC Roundtable event here at Lodge at Ventana Canyon. We are pleased to welcome our live audience and special guests, Audra Winters from the Marana Chamber of Commerce, Sam Rowe of AmeriGroup, Laura Oldecker, former chairwoman of the THCC and my comadre, our board of directors in attendance, Carla Morales, current chairwoman, Lindsay Welch, and our distinguished panel, Nancy Johnson, Councilwoman Frias, Dr. Susanna Cooper, Piper Fritzen, and our moderator, Lucy Howell. We also want to thank and acknowledge today's presenting sponsor, AmeriGroup. Let's give them a round of applause. Thank you for sponsoring. Thank you for making this possible. Before we start, I want to invite Carla Morales, chairwoman of the THCC Board of Directors, to share a few remarks with us.
I'm a little bit taller. Thank you all so much for joining us this morning. It is my pleasure to be here representing the Tucson Hispanic Chamber. The words thank you cannot be, they're just not enough to express the gratitude that we have for our community and for our healthcare workers and our healthcare heroes. There was no preparation, right, for what began a year ago, but the words selflessness, compassion, strength, and resiliency come to mind right away when we describe the response we have witnessed from our healthcare and frontline workers. Please join me in acknowledging the healthcare individuals here today and those not present. We value the opportunity to highlight their contributions in shaping our recovery. Thank you so much.
Thank you, Carla. And now it's my pleasure to introduce our keynote for this morning. Directly from California, right? The power of technology and COVID age. Dr. Richard H. Carmona, MD, MPH, FACS 17th Surgeon General of the United States, and Distinguished Professor of the University of Arizona. I'd like to ask everybody to please look towards our screen as we welcome him.
The United States, a distinguished professor at the University of Arizona, and the reentry director at the University of Arizona working with President Robbins. And what that means is I have the oversight for all of the COVID actions that are going on campus right now. Everything from bringing students back onto campus, as well as interfacing with the county, the state, and the nation, and preparing our students to come back to campus as soon as possible with vaccinations and appropriate public health practices. So it's more than a full-time job, but one that I enjoy doing, working with a great leader like President Robbins, as well as the team that we've put together, which is second to none in the country. So I've been asked to talk about health and wellness because I understand that's the topic of your choice for this meeting. I'm sorry I can't be with you today because I have already been scheduled to be out of town at another meeting where I'm speaking on a similar issue, but I thank the Chamber for allowing me to at least to be with you virtually. And I'll talk to you about health and wellness, but in a COVID environment, which makes that a little bit different. As you know, COVID is a challenge to all of us, but COVID can also be an accelerator of some things and actually has helped some business. So I'll talk a little bit about that. A short history. As you know, this is the first pandemic that we have experienced in over 100 years. In 1918, the Spanish flu, clearly a misnomer, but nevertheless still refer to it as the Spanish flu, occurred and devastated the world at a time when we were still in the First World War. 102 years ago, and now we come forward and have to deal with the pandemic again. Let's talk a little bit about that history over the past year, because what's important is you understand what has happened. Normally, when we look at dealing with a pandemic or any challenge to the health, safety, or security of the nation, we use a continuum, and it's part of our national response framework. That continuum starts with prevention. Have we done everything we can to prevent whatever the challenge is, whether it's a terrorist event, whether it's an active shooter, whether it's a biologic terrorism, or whether it's a pandemic? All fill out under that umbrella of all hazards preparedness. In this case, it's the pandemic. So when we answer that question, how did it get here? How did it spread so fast? First thing we have to recognize is the prevention practices we had in place. Things that, when I was Surgeon General, we had put in place, and my colleagues who followed me, where our National Security Council had a special team for pandemic awareness that surveilled the world all the time to find out where infections were coming from to make sure we'd always be protected. Last administration came in and unfortunately felt that these teams were not necessary and disbanded them. In retrospect, a terrible thing that made us less prepared. Our CDC, where is more or less the federal government's Centers for Disease Control and Prevention, some of the smartest scientists in the world there. And in there, we have prevention specialists, we have epidemiologists, but we also have had in the past housed what we call push packages. These are packages of goods that any community may need during any all hazards emergency, including a pandemic. It could be IVs, it could be drugs, ventilators, beds, blankets. Unfortunately, because of cost reductions, this particular program was minimally funded. And when the pandemic hit, we were not aware, as we should have been, because the surveillance team and the National Security Council had been disbanded, And we were less prepared at CDC because the programs there necessitating readiness were not ready. So from prevention and preparedness, we moved to be able to respond. And respond we did, although it was late. So let's look at that. By the time we got involved about a year ago, the country wasn't sure what to do. We were being told by politicians on one side that this is nothing, it's just a common cold, it's all going to go away. In fact, we were told it would go away by Easter. And in fact, another Easter is coming up and we're approaching 600,000 deaths. So far from minimizing it, we should have been focused on this particular issue. And in fact, unfortunately, what I call the plague of politics potentiated this, because at times you could argue that the politics were as virulent as the virus itself. And so as we moved through the year, what we saw was not a United States, but a disunited States. Each state had a different way to approach this. And often it was along political lines, which was the last thing we should have been doing, because this should have been treated as a war, that we all come together around a common value proposition to protect the health, safety, and security of the nation. And of course, when each state is doing things differently, and within those states, some cities are doing things differently, you look at all the combinations and permutations of approach to this problem, and the public becomes exhausted. They have COVID exhaustion. Who do I believe? Who's telling me the truth? The federal government, the state government, the local governments. So the public, because of that, is not sure who they should believe and what action they should take. In addition, we end up with what we call vaccine hesitancy, that people are hesitant to get the vaccine because they're not trusting their government. Now, mind you, it is important, as you all know, as businessmen and women in the Hispanic Chamber, that we look at the implications as it relates to the business, no question about it. But we can't look at either one solely alone. You have to look at it in context. What are the implications of this virus? What can it do? And then how do we keep our businesses going, even though they're probably going to have to change the way they do business and be innovative. But of course, when we look at it politically, there was these diametric opposition rather than meeting in the middle and figuring out how to do this. So that delayed a lot of things. And of course, it created more deaths, disability, more cost, more things that were preventable. So as the virus spread throughout the country, we recognized it was going to be a challenge or headwinds, but we also recognized that the virus itself was an accelerator as it related to some aspects of the business community. So if you were in the hospitality business, if you were a meeting organizer, if you dealt with conventions, often where people come throughout the year in Tucson, but especially in the winter months, you found out that probably you didn't have a job, or it was very, very much reduced because of travel. On the other hand, if you worked in the digital space, if you worked in immunology or basic biologic sciences as it relates to the research necessary to develop a vaccine, which we have done in this nation, the fastest in history. If you were in the consumer products, a company that made or distributed sanitation products, you did very well. Your stock price probably zoomed, your value went up. So on both sides of the equation, we saw challenges and we saw opportunities. For those who were innovators, of those who saw an opportunity to do something innovative, disrupt the market with maybe a sanitation product, maybe a biologic product, maybe a vaccine, and those people did very, very well. The challenge is the headwinds we also had, because as we tried to deal with this virus, we also recognized that it reared its ugly head in different ways. It potentiated health disparities. It potentiated the vaccine inequalities. It potentiated so many challenges within social and health. And what that means is those people who were not well-to-do, or at least moderately well-to-do, that had a stable situation and so on, they did better. Those are the people who could get the vaccine maybe earlier. Those are the people who understood. But when we look at the population here in southern Arizona, large Hispanic population, large immigrant population, often the social determinants of health are that they are less educated. They are good people. They are hardworking people. They're willing to take the jobs that no American wants to take. And those are the people that come in, work tirelessly, anonymously, behind the scenes, washing the dishes, making the food, and in a few years they own a restaurant or they own a business. And in a few more years they send their kids to college because that's their goal. So this is really the essence of who we are as America. That is why we are so good. And paradoxically, of course, the very strength of this nation, which is the diversity that has built it since its inception, paradoxically still divides us every day. And that's very unfortunate, especially in a pandemic when it potentiates the disease and creates more problems and launches conspiracy theories that are not supported by any rational thinking. So looking at both sides of that equation, we have profited and we lost. We're approaching almost 600,000 people now who have died. Irreparable harm, families divided, a mental health toll that's still hard to calculate. Children who have lost their ability to learn basic interpersonal relations, facial expressions, hand gestures that tell you how to react with people. You're all on a screen now. The friendships that normally have developed, the little posses that would form for the girls and the boys to play, it's not there or minimized. What are the social and anthropologic challenges that are going to happen in the next few years because of the loss of those years? It will be devastating, but we're trying to figure that out right now. So I described some of the headwinds, some of the challenges we're having. One of the things that we have to do now is come together as a nation. We're at war with an invisible enemy, this virus. This is no different than coming together after the Second World War, where there were no Republicans or Democrats. We came together as one to fight a common foe. The common foe here is this virus. And the fact is, we need to come together now, where all of us embrace the best public health practices. All of us get vaccinated. All of us work together to keep our businesses open safely, to the restaurant that innovates and puts chairs outside and keeps the social distance and wears the mask and makes sure their workers are vaccinated. Different ways. The world is not going to move forward the way it was before. It's going to change drastically. But we have the opportunity to create that future for us today. And we're seeing it happen. We're seeing it happen. But no more divisiveness. No more crazy conspiracy theories. Let's stay focused on the best science. Listen to what your doctors are telling you. Listen to what the scientists are telling you. And today, although things are looking better overall, even in Pima County, we're having a little bit of an uptick in our cases. 20 states or more around the country, right as we speak today, are having upticks in their cases. We are not out of this pandemic yet. This pandemic we are still in. And if we don't handle it appropriately, we can get another surge that will set us back. If that happens, the virus has more opportunities to mutate, that is, change its characteristics, become more transmissible, become more lethal, create more chaos, more cost, more loss of life. So not only is the vaccine important for us personally and our families, it's important because you are making a contribution to bettering society, preventing that virus to go someplace where it can still spread. Once we get to 80%, 85% of people vaccinated, the virus has a little place to go and it becomes dormant. Now, for those of you who are old enough like me, and you can remember back to the 50s and 60s, you remember our moms and dads were worried about us getting polio. But Dr. Sabin and Salk came up with a vaccine, and we all took that. I remember as a little boy, Mom not wanting you to go to school because some of the kids were living in an iron lung now because they couldn't breathe because of polio. The reason polio was eradicated, we rapidly vaccinated all the children, and the virus was not able to spread. You don't see polio anymore in the United States, and vaccination is probably the most important scientific discovery in the history of mankind, because we don't see polio, we don't see measles, whooping cough, tetanus, all of these diseases that are vaccinatable. Sure, there are some mild side effects. Most of these vaccines, you have a sore arm, you may feel a little sick, you may get a headache, but the value you get from it to not get a disease that can kill you, there really is no argument why you shouldn't be vaccinated, except for those very few people who may have a unique allergy or problem. So I'm asking all of you as leaders in our community, our Hispanic community, to please reach out to all your businesses. Make sure that you have the conversation with your workforce. Make sure that they have the opportunity to get vaccinated. Make sure that their family gets vaccinated. And as the numbers drop as far as the safety for youngsters, make sure that their children get vaccinated. We're all working together as one to be able to extinguish this disease so we can create the new world that we need. And most importantly, we must remember that people of color, African American, Hispanic, our Native American brothers and sisters are disproportionately disadvantaged. We're dying in higher numbers. We have more complications because of a whole host of issues that we determine based on what's called the social determinants of health. You're poorer, you have less education, you don't live in the best conditions, especially the new immigrants who are coming and working hard and toiling to make their way here and prove their worth in our country by doing all these jobs that quite often nobody else wants to do. But they have a goal, they have a passion, because they recognize that the greatness of America is this diversity, that they have this opportunity. So what we're doing, and President Robbins has been very, very vocal about this, is to make sure that all of our teams are working with the county, the city, the state. We speak to Mayor Romero all the time. We speak to Mr. Huckleberry all the time, as well as the state leaders and the governor, to make sure we have enough vaccines to work with our counterparts in southern Arizona. So Pima County and the health director there work with her routinely. We will help them. We, in fact, took on a responsibility of vaccinating for K through 12. But we're also working in Santa Cruz County. We're working in the other counties in southern Arizona. We're out in Yuma. We're in Maricopa County, Cochise County, because those counties have few resources at times. So we are providing supplemental ability with our rural health office from the university to be able to increase vaccinations in all those populations. So let's remember, people of color, our fellow Hispanics, African Americans, Native Americans are disproportionately being affected. So we must do everything we can to get to them, because often they can't come to the clinic. They don't have a car. They don't understand. So we are doing everything we can as the University of Arizona to ensure that we reach these populations, helping the county and the city and the state to make sure we can eradicate any opportunity for this virus to go to these populations who are already suffering because of their social status and the vaccine inequity, which we are trying to eradicate. So thank you all for allowing me to be with you today. I really wish I could have been here in person and answered your questions as well, but unfortunately I was scheduled elsewhere today. But I am available to you anytime. Just call me if there are any questions. And thank you for all you're doing to encourage and inspire your workforce to get out, get their vaccines, to keep a mask on, wash their hands, stay socially distant, stay in your family bubble of people you know. That will get us to the level we need to be as quickly as possible and get rid of this virus so we can move into the world that we are creating. Thanks very much. Hasta luego.
Good morning, everybody, and thank you for being here. My name is Isabel Georgelis. I'm the interim president CEO of the Tucson Hispanic Chamber, and it's my pleasure to see you all here joining us this morning. That was an incredible speech by Dr. Carmona. Certainly the words challenge, coming together are important words because they speak to how overcoming this challenge that we have right now is about all the people in this room and outside of here, right? And that's part of the reason why we're doing this, is to be able to connect with our community and share how we can all be part of this economic recovery, right? That connects with every industry, every person in this community. Nobody's excluded. So we all want to come together. And I'm also pleased, if you haven't noticed, but we have some incredible people dedicating their time and expertise to come and share information with you. So we do want to thank them. You'll be hearing from them soon. We also have our corporate members who support and sponsorship help us contact and deliver this information with everybody. So we thank them. And I also want to thank our media partners who are instrumental in messaging out the work we are doing at the Chamber, so we thank them as well. And I would be remiss if I didn't draw your attention to my incredible team. Some of them have disappeared. Maybe they've gone to do something, but they're right over there, so wave. And thank you to them for the work that they're doing to help us connect with all of you. And lastly, our hosts here, at the Lodge Ventana Canyon. Thank all the staff for the incredible meal we just enjoyed. Isn't it great to get out and be in community? Isn't this wonderful? Yeah, let's give it a hand. Not to mention that we have an incredible view you'll get to see shortly for those of you that are watching or streaming, and as well as a great meal. So be sure and visit this location. We are trying to help all the businesses, everyone that is trying to continue to operate during this time. So come and spend time with them. All right, with that said, I'd like to take a moment to introduce you to this incredible panel. So first off, please join me in welcoming Nancy Johnson, CEO of El Rio Health Center. Next, we'd like to welcome Herminia Frias of the Pascua Yaqui tribe. Councilwoman Herminia Frias. Thank you, Councilwoman. Next, Dr. Susanna Cooper of the Arizona Oncology. Piper Fritzen, Administrator of Casa de la Luz. Sorry, Piper, my accent came out in that pronunciation. And last but not least, Lucy Howell, Managing Director of Force for Health and our moderator for today. Una vez más, gracias a todos por acompañarnos el día de hoy. Estamos muy entusiasmados por traerles esta presentación. So, welcome and let's get started. Lucy, it's all yours.
I'm going to kind of angle a little bit like this so I can see my wonderful panelists. First of all, thank you so much, Isabel, and always, the Tucson Hispanic Chamber does a phenomenal job. So can we just go ahead and give them a round of applause for, first of all, reactivating in-person events, and also for doing such an incredible job transitioning through this, through this challenge to the other side, right? So this hybrid event is a perfect way to do that. And so it's nice to meet everybody. I personally am passionate about population and community health, so thank you, Isabel, for asking me to moderate this for. Now we've got a couple questions here. We've got about 40 minutes, but I wanted to just go down the road and let's go down the lane and introduce yourself, what your role is, and who you're here, and then we'll kind of jump into some questions.
My name is Piper Fritzen. I'm the administrator for Casa de la Luz Hospice and Palliative Care.
I don't know.
Can you hear me? My name is Dr. Susanna Cooper. I'm a medical oncologist here in Tucson and taking care of patients in St. Mary's as well as down in Green Valley. And thank you very much for inviting me.
Minnie?
Good morning, everybody. My name is Herminia Mini Frias, and I'm one of 11 tribal council members for the Pascua Yaqui tribe. And in case you don't know, we are a tribe located here in Tucson, Arizona, and we have communities located throughout Arizona. And we also, we're part of the Hispanic Chamber. We have Casino del Sol, which is a major employer here in Tucson. The Pascua Yaqui tribe employs about 800 people, and our Casino Enterprises employs about 1,800 people.
Nancy?
Yeah. Good morning. Thank you all for inviting me. My name is Nancy Johnson. I'm a nurse and I'm the CEO at El Rio Health. We are one of the nation's first community health centers. So I'm always great to see Dr. Carmona because he received all his care growing up in a community health center in the Bronx. So he is one of our products we're very proud of, right? But we take care of about 115,000 people here in Tucson. These are about 42% of those individuals live at or below federal poverty level. So we take care of the most vulnerable, fragile in our community in an interdisciplinary model of care. So we're happy to be here today. Thank you.
And Dr. Carmona set the stage perfectly because I don't think that many people realize and recognize what factors come into play when it comes to personal health. And so when he says something like the social determinants of health, raise your hands if you've ever heard of social determinants of health. Okay, many people have not.
And it's actually estimated in some circles that only about 36% of a person's choice for personal health is individual decisioning. So think about that. A majority of health factors, such as social terms of health, access to healthcare, access to transportation, financial literacy rates, et cetera, those all go into a community health level. And so it really does take all community stakeholders to come into play and impact that. I have some questions, but I really would like to go down the road. Now, if you don't notice, we have healthcare organization, largest in southern Arizona. We have tribal representation, we have physician representation, and we have end of life, hospice representation here. So I'll start with you, Nancy. In 1 minute or less, summarize this past year as a leader in the healthcare organization, community health space.
I can do this, yes. So last March, about the middle of March, all of a sudden our patient population that we were seeing across our 12 health centers every day dropped by 50%, right? And we had our toe in the shallow water of doing telehealth, but within 2 weeks we had a robust telehealth platform set up, and we were using our population health data analytics to reach out to our most fragile people, our elderly, people who just got out of the hospital, people who we know through our population health system don't have transportation, live alone, maybe don't have any support. We were able to start delivering medicines to them. We were able to deploy some of our staff out to their homes, all in, to your point, across the continuum of care. We sit in that space of primary and secondary prevention. So our job is to prevent disease, keep people as healthy as possible with early screening, and try to optimize the health of the population. So when that happened, just one more sentence is that, amazing people, gets me all emotional to think about our staff, just really fabulous people work at our health center. They all were super flexible. We had to close dental down. Our dental hygienists learned how to swab for the COVID vaccine. They're all running vaccine clinics every day for our patient population, because you figure we have about 80,000 people to vaccinate alone in our ranks at St. Elizabeth. And many of them are people of color, right, that don't necessarily think the vaccine is important. So that relationship with their physician that they see at El Rio is super important, to say, I've been taking care of your diabetes for 10 years. I'm recommending the vaccine. Let's do it now while you're here. So just the amazing staff that have been every day being flexible and doing what we needed to do for a community has been so powerful. 1 minute.
So nimbleness and the ability to innovate and respond quickly is, critical.
And it has changed us for the future. It made us stronger and better.
Just like Dr. Carmona said on the upside. Minnie,
can I make one comment? I just want to say that Pascoyaqui tribe has had a long relationship with El Rio. They are a primary healthcare provider. So, we do appreciate all of the work that El Rio has done. It's for years, but, especially during the pandemic. So I just want to say that.
Continual great partnership. Thank you.
And I'm going to call you Chairwoman Frias. She is a
It's
friend of mine,
council
so
now,
I was being a little informal there. But tell us the last 12, 14 months at the tribe. What's your perspective in summary as we sit on April 28th?
Well, it has certainly been a whirlwind, but I think one of the things that we keep talking about is that resilience in our community, and how without, how it comes back to our Yaqui culture and our UME self, and how historically we've been through this. And we always go back to our cultural values and how we have lived through pandemics before, and how we have historically lost, and it's been a painful and emotional challenge, but we have recovered, and how we have taken care of each other as a community. And that is really what we continue to message to our community, because in the beginning, it was very difficult. But from the very beginning, we knew that we as tribal leaders had to take care of the community, because as Dr. Corona said in his speech, The federal government has never taken care of Native American tribes. Nobody has except us. And so therefore we needed to step up. The whole system has been created with bureaucracy, and therefore we need to take care of us. So we stepped in and said, let's do what we need to do, and we'll let the feds and we'll let the state and we'll let everybody figure it out while we're doing our part. And I'll tell you this, everything that we have been doing is now being implemented in other areas and learning from what Indian country has done, not just Pascoyaki tribe, but what Indian country has done. And so in this past year, it has been done what has been done is, what have we done as part of our cultural values, our innate instincts? And that's how we have continued to value ourselves, value our people, continue our traditions, so that we continue to have hope in the future and continue to teach our young people that we cannot give up. This is painful, but we will continue to exist as we have, as tribal people, as a community, and continue to persevere because we are resilient.
I love the first two questions and the first two answers, because they come off so positive. It's hard to say that, but it sounds as if we look at April 28th and look back that we're proud of how you've collaborated and worked together. From a physician's standpoint, what would you have to say? How's the ride been from your perspective?
Yeah, so I would say similar to my fellow panelists, this year really has been marked by teamwork and innovation. I don't think any of us ever expected to be faced with this kind of challenge, although we probably should have. But I think, initially we were very unprepared as a community, as a country, as a world. And initially, it was almost a little bit of a stun and fear, as far as in oncology, we have patients that are at very significant risk of severe illness at all points in their treatment. And then to add a virus that we didn't understand, we didn't know how to treat, and at the beginning, we didn't even necessarily know very well how to diagnose. And so at first, we kind of shut down to as minimal as possible, trying to reduce the risk, thinking that this was going to be a relatively short-term problem. And as is typical, we underestimated a little bit the complexity of the situation. As Dr. Carmona was mentioning, we were led to believe that this was going to be a short-term problem and created short-term solutions, which have not been sustainable. So as the pandemic has developed, we have had to create longer-term solutions for our patients, for our families, reassure patients that are receiving treatment that we are evaluating the safety and have been implementing safety measures to ensure that everybody that we invite into the clinic is going to be able to come safely and not be exposed as much as we can. And I think that we have done a very good job. I mean, the whole, I don't know if you guys have been to the hospital, but the whole process of going into the hospital is so different now. You're screened when you walk in. Everybody still is getting their temperature taken, and visitation is being limited to as much as is necessary. And the same thing applies in the clinics. And so I really think that we have created an excellent environment to be delivering safe and effective care to everybody that we invite in. And so that's been the year in summary.
You said something earlier on that we weren't ready for this pandemic. And if you really look at it, and this is hopefully one of the takeaways today, is that we were already in an pandemic tsunami. If you think about the status of health even before COVID hit, okay, and if you look at those most vulnerable, so hopefully, we can take the preventative measures, we can care about owning your own health first, so that you can turn to your family and say, Papa, come on, come walk with me, okay? Tita, come on, let's go hike, and those types of things. So yes, we weren't prepared, but we were also, I'll just challenge to say, a little complacent, So I just wanted to kind of tag off. Casa de las Luz, please share with us what your perspective has been the last 14 months.
So I think we all look back at the last year and think, what a long year. Has it only been a year? And so I have to say, reflecting back, I am thankful and grateful that we've been able to serve the community. So we had to change really quick how we operated and how we served. We went into it knowing that we would serve the community through the pandemic and knowing what that looked like. Switching to using telehealth, which we were dipping our toes in telehealth for our palliative care, but now we were doing it just to serve within the facilities and have those patients have those needs. We became the conduit between families and their loved ones because we were allowed in and they weren't allowed in. So we got to switch to more of that social support than even the clinical support. We did see an almost 9% uptick in all related to, I shouldn't say all related, in some ways related to the pandemic, whether it's people that were on a chronic illness path that now can't see their family, so they're not eating as well, so then they end up becoming a hospice appropriate patient. We have been able to serve 220 COVID patients that we were able to serve them at end of life with zero transmission to our staff. So innovation around securing supplies, innovation on how we serve, using telehealth and those outreaches. For us, I foresee us continuing to serve into the future. So switching our bereavement programs to not just those that were on hospice for cancer or cardiovascular needs, but we now have a COVID survivor group and a COVID support group. So moving our focus into how we serve our community differently coming out of a pandemic. So we look forward to continued innovation and taking the lessons that were very hard and moving forward into the future. But I do have to say, it's like when people say, well, when did this happen? I'm like, what part of the pandemic was that? It's just a difficult year.
Isabel wanted me to kind of lay out some general themes. What has sustained, what has transformed, what has collapsed, and what will emerge. And a couple of you have touched upon telehealth. My dad hates it, okay? So I would like to touch upon telehealth. And let's just go down, let's start with Casa de los Luz. Do you feel it's helped, hurt, neutral? Some comments about telehealth and the sustainability in the next 12, 18, 24 months.
So it's done all of those. So it's helped in the fact that we can quickly see patients. So there's not a drive time. If there's something unfolding, we can immediately pop in and see that patient. So that's really, really helped. How it's hurt us, which it's interesting when we talk about what has collapsed in the last year. Human touch, human contact. So it's great to be able to immediately see and talk to somebody and feel that connection. But again, it's missing that ability to see hand gestures or touch or give a hug. So really, I think that telehealth has taken away some of that physical contact. But in turn, it's increased the time that providers can spend with loved ones. It's connected us in ways that families couldn't connect before if they couldn't get into a facility to see their loved one. So I think that there's been some great benefits. But again, I think the biggest loss with telehealth is just physical contact.
Nancy, I'm going to go straight to you. What is the bilingual capability to support the telehealth need here in Southern Arizona? Are we short? Are we meeting it? What's your perspective?
Well, for our organization, we're meeting it. At least probably 60% of our employees are bilingual and bicultural. So from the Hispanic perspective, but we have a lot of patients. Oh, I'm so sorry. Yes, thank you. I'm like, why is he gesturing? Is he speaking other languages still? But, we also have a lot of patients from a lot of the Congo countries, from Vietnam, from China. So we have been using, our elaborate system with Sericom to do some of that translation across telehealth. I might add on to the telehealth where we have seen the most growth during the pandemic has been in behavioral health. and just a huge spike in telehealth visits for behavioral health as we see people struggling, not only with isolation and loneliness, but the increase in substance abuse and people not being able to access their support groups and their care. So we have a lot of telehealth groups going on as well. As a clinician, some of my concerns about telehealth are that it just becomes the easy way to get care. That we always have to be able to say, you know what, I need to see you in person, not okay with this, right? So I think as we look across the state, we're seeing legislators and policy at the state and federal level determining protocol and criteria for when we will use telehealth. So I think we have to be cautious because not only the touch that you mentioned, but clinically there are times when you really want to see and touch and smell your patient and, go through all those things. So I think from bilingual, I feel pretty good about Spanish. I always do across our population in live or telehealth, but some of the other languages have been difficult. We have patients that absolutely love telehealth, and I get feedback about that. And we have other patients that are like, I don't like that at all. I don't want to ever do that like your papa, right? So I think it's a patient choice issue.
And I'm just going to call you Minnie because it's just the easiest thing for me. Rural health community access has got to come into play too. So I look at the tribe, cultural access. What are your thoughts on telehealth?
We hated telehealth. Our community does not like telehealth. It was not popular, and it's not popular because, especially with our elders. And I think when you talk about social determinants of health, that is one of the ones that, there's a lot of assumptions around telehealth. Oh yeah, it's simple. You just go on the phone and everybody has a smartphone and you can just get on the smartphone. And even for me, behavioral health, you can just get on it and you can log on and you can see your provider. It's not that simple. And so one of the things that we encountered was that not everyone had access to a smartphone. Not everybody even knew how to use their smartphone. Not everyone had the data capacity on their smartphone. Not everyone had, so these were all aha moments that we were learning on a day-to-day basis. Like, why aren't you seeing your counselor? I'm not gonna use my smartphone and use up all my data so I can talk to my counselor. And it was like, oh shoot. When we were sending out messages to our community about what to do about COVID, and we were sending them via text message because we thought, oh, we have a great idea. Now we have this new message. And then they weren't opening them. We're like, why aren't you opening them? I'm not gonna use my data to open your text message. And it was like, so these were things that, because they were on limited data, and so all these new things technology that we think is great, we were not having that conversation with people that have these smartphones that didn't know how to use, except, people were programming phone numbers into their phone so they can just call and talk to someone. And so those kinds of things that they didn't feel comfortable talking on this, people had to show them how to use it and how it worked, and they wanted to see their providers, so therefore they just wouldn't go. So they were going without care. They're not seeing their providers. They're not, seeing anyone. And what is the result? What is going to be the result? What are we going to see in the long term?
If you look at the circle of social determinants of health with the Healthy People 2030, there's not access to technology. This COVID has identified and exposed it's not new, right? We're seeing it in school and more particularly here in health. From a physician's perspective, have you utilized it? Do you like it? Has it made you can see more people throughout the day? What's your perspective on the use of telehealth?
Yeah, so I think as we all know, tools are how you use them and how they're applied, and communication is key. So as a provider, I love telehealth because it's another option for me on how to reach patients and how to adapt their care to their needs. And there are certain problems that don't require a visit, and it is much better utilization for the patient to be able to log into their telephone and get the results of something that's pretty quick, but have the opportunity to ask questions. And many times we were doing those over the actual telephone, but I find that the addition of looking at somebody actually adds something to that encounter. But as we have discussed, there are many patients that isn't a feasible option. And I think the communication at the time of the discussion of the telehealth counter is key, and for patients to feel open and saying, this is not an option that works for me, which can be very difficult because these are complicated issues, and sometimes it's related to finances, and people are uncomfortable saying, I don't have enough data. And there have to be, I think we do have to be very aware of those issues so that it can be addressed in the appropriate manner so people aren't uncomfortable, but then they're able to get the care that they need. And so I think that it's an excellent tool that's been a great addition to medical care, but it needs to be applied appropriately.
We had the chance to co-host a multi-generational Saturday health family camp, and it was, many times people don't want to admit that they have no idea how to download an app. They're just not going to say it. They're going to come up with some other excuse. It's also, daughter might share phone with mom and brother, so not everybody has individual device. So it's just these things you don't know what you don't know until you know you don't know them. And now we know them, and now we have to address them, right? Telehealth and the end of life. How have you used telehealth?
So we've used it quite a bit because a lot of the organizations that we serve within stopped allowing visitors in. So it gave us the ability to see our patients, to connect our patients with families. And then we use it for bereavement as well. So we are doing community support groups via Zoom. Not really telehealth, but technology. But we do have some of the same issues where people want to be face-to-face. End-of-life conversations and bereavement are hard conversations to have, sometimes over a phone, or if they're home alone. So really adapting what's best for the person or the patient, but we have had to use it quite a bit, and it's benefited us through this pandemic.
I can't believe that I didn't even think about it. I mean, really, the end of life, whether it's at the hospital or hospice, has really all been telehealth, really, via the iPads. Wow.
Just one more interesting thing about telehealth that has surprised me is the numbers of our patients who have participated in our health and wellness classes on Zoom, where we have meditation, Tai Chi, Zumba classes. People have really engaged in those. I'm not sure they're ever going to come back to class now that they can, do yoga in their room and watch the instructor and her cat going behind her or whatever's going on. So that really surprised me because I didn't engage in that at all.
You're right. I mean, the workforce is seeing that now. I have worked remote since 2001, right? So I've worked out of my dining room as a national biz dev person. And so now I hear all of these employees going, I actually like working out of home. I don't think I choose to go back to the office. I'm like, I don't think you have a choice, really. I mean, if you want to stay working.
We had a company call us yesterday saying that they're all going to stay at home now, and do we want to sublet their space?
That's
I said,
right.
No, I don't want your space, but you're all staying home. Yep, we're working from home.
Well, that meets on one of the things that have collapsed, right? The brick and mortar necessity to actually get work done. Is there anything that existed before COVID that you see has completely collapsed and just will not come back? It's kind of hard for me to think of something, but I'm curious what your feedback is. We'll start with Piper.
So my biggest concern, because bricks and mortar for healthcare, you're always going to have bricks and mortar. You're always going to have physician needs and touch needs, but I think it's relationships. I'm concerned on what is that going to look like today, 6 months, 12 months, 18 months, that relationship, that ability to touch and to you get to a meeting now where you, just like today, we all got here and it's like, do you shake? Do you elbow? Do you hip bump? Like, what do you do? So I think our biggest thing that I see from a healthcare provider is the relationships are changing, and hopefully it hasn't fully collapsed. Hopefully we can regain, but that is my biggest concern. Bricks and mortars, I love shopping on Amazon, so I'm okay with that. But it's going to be an interesting road.
Agree. You see anything that's collapsed that really might not come back as it was pre-COVID from your perspective?
I'm not sure collapse completely and not come back, but something that is a very big concern of ours in oncology and just general wellness for the community is that in April of 2020, basically all screenings for cancer completely stopped. And that has still not become up to fully operational. And you know, that is predicted at this point for just breast and colon cancer that upwards and quite possibly more of 10,000 people will die over the next 10 years because of the delay in screening. Now, that was balanced with the decision of the people that would have died if they had gotten COVID. So in the time, it seemed like a very reasonable, it was a very reasonable and understandable decision. Now we're faced with picking up the pieces of that decision, getting folks to be coming back into their screening, having the ability to get everybody in that was, you know, missed during that time period, reaching people back for their preventative care visits so that they can be referred to their screening. And I think that it's going to take a very long time to get us back to where we are functioning at a normal level. And you know, I think that's something that as members of the community we need to be aware of and encourage everybody that, you know, at this point it is recommended that we get back in, get your screenings done, get your mammograms, get on the list for your colonoscopies, so that we can detect malignancies at an earlier stage when we can treat them and they are survivable.
What about you, Minnie?
Well, the thing that hasn't fully collapsed, but I hope it does, is the way that we think about our system of care when it comes to our scheduling with our employees and that 8 to 5 model, and thinking about our parents and thinking about, you know, children in school, and just being more flexible because we can do it. And you know, we've been operating under this 8 to 5 for so many years, and now we know we don't have to do that, and that we need to be more responsive to the community. And so when we're, you know, going back to work and people are having different types of schedules, that's what we're thinking about is, you know, if there are parents that need to work at home and have flexible schedules because some of their kids, you know, have, you know, a unique schedule, then we should be flexible with that. You know, if they have Saturday hours or if there are certain things, like we know we can do it. So that and being able to communicate with everyone so that our programs and services operate in a different way and in a better way so we don't have gaps in services. I hope all that stuff collapses, because I think if anything has shown is how we need to work better so that we can serve better. And so we just need to do a better job and continue to do a better job. And that 8 to 5 is baloney. You know, it's like, we don't need to do that. You know, it's about service. And so I hope that will eventually collapse, because there's so many kids out there that are at home and that, you know, are trying to figure out this homeschool, and that will continue to be at home, and so many kids that are in school. And so there's just so much different ways to be innovative, and we should allow that innovation to continue.
Nancy, I was going to pop off what she just said and kind of hyper-focus on our youth, because they are our future workforce, right? Unless you wanted to answer and had an answer already for the collapse question. I don't want to leave that on the table.
But, you know, the panel members have caused me to think about a few things. One is that you know, we start opening our clinics at 7 a.m. They're open till 8 p.m. and they're open on Saturday because of what you have just talked about. And, you know, with our employees, I've had to say to them, you know, our patients did not get the memo that you wanted to work 8 to 5. So, you know, but that expanded service helps families so much. If they're picking their child up from school and they find out they're sick, they can come right in And, we've built 24/7 access to nurses who can schedule appointments for them. So trying to help the families because they have enough going on, to your point. The other comment about screening, it's been really interesting for us too, particularly colorectal cancer screening. We look, as you said, to the Healthy People 2030 goals around colorectal screening particularly, and mammography. And we've seen such a decline in those that we are pushing on Care Can't Wait is the campaign we have going on. Get in, get your screenings. We can do all that at any of our health centers. You don't have to travel around to labs or other places. So we've been picking up, we've picked up since we started the Care Can't Wait campaign, colorectal cancer screening has gone up about 3%. And to move 1% in our organization, we have to screen about 360 people. So our staff are all really focused in on improving those screenings, knowing how important that is. And then the one thing that I do think I kind of worry about from a collapse perspective is our healthcare workforce. We've had lots of people who have said, I'm going to take a pause. This is really like too much. I am pausing. I'm not going to work in the hospital anymore, or I'm not going to work in the long-term care or whatever. I'm pausing. And then we also have had staff who've had to take care of family members. The long haulers you hear about that 30 days in the hospital. We now are doing home health. We have oxygen therapy at home. We're doing pulmonary rehab with a family member. So that's taking people out of the workforce. And then, of course, the children. I have counted my blessings a million times that I am not raising children in school during the pandemic because I just don't know how they're doing. I don't know how our parents, our families are doing it. So within our workforce, we've seen more people taking FMLA, more people, needing to change their hours just for all those systems in our community that are in collapse or remodel. Yeah, but where were you going to take us?
Well, I'm glad that you said that. My son is 18 years old, so I'm right there at the having to live with a senior that basically just lost his senior year.
Aww.
And when I mentioned earlier on the pandemic, even pre-COVID, I don't know if you guys know this, but we are moving 38 to 50% less than we were 25 years ago, okay? That is coupled with the obesity rates at all-time high. Okay, if you look to the right, look to the left, 38% of us are living with a preventable chronic disease, okay? And the disparities are now no longer tolerated. So you see civic unrest and violence. It's scary. And the other thing is this whole mental state of our young people. And as a chamber, we are a chamber of employers, right? So there's this learning loss. What can we do as a community to help close that gap? The last figure I just wanted to share with you is that we are on track. I don't know if you know this. The disconnected rate of our teens, 18 to 24, it's defined as not in school or not working. We are on track to be twice the rate of what the Great Depression was with our current 18 to 24-year-olds. That's all pre-COVID. Now COVID hit, and there's a huge gap. There's also a 30% reduction in youth sports play over the last 5 years. So this whole coping mechanism, mental state status, please give us the magic answer as to how we can close the gap and try and slow down some of these mental health rate issues that are really going to be affecting our youth. Nancy?
So some of the things we're doing, to your point, there's a huge gap in professional services in our community for youth ages 10 through 18. In terms of, I get calls all the time from my colleagues, from community who are saying, my daughter's been homeschooling since January. Now she doesn't want to come out of her room. She's not really eating. I'm a little bit worried, can't figure out what's going on. And by the way, I can't find anybody in behavioral health I have insurance. I can't find anybody to help. So we have a large shortage of mental health professionals, particularly from child psychiatrists to anybody working in that area. So that's actually, I don't know if you know, that's one of our initiatives this year is really working on developing behavioral health for that population. So we're doing some collaboration with the United Way, with the University of Arizona, with the health plans around trying to get more resources in that area because there just isn't the talent to work with that. But I also like to think about some of my happy thoughts. about the future generations. You know, I'm very happy that Pima County will vote to budget $10 million a year for preschool for 3 and 4-year-olds, so that any family living at 200% or below federal poverty level will have preschool for their children. So we won't have all these kids starting kindergarten that are already behind with their peers and colleagues, so that we try to equal that playing field. City of Tucson is also stepping up with at least $1 million a year for that as well. So we appreciate Mayor Romero's support for that. And I saw President Biden is now encouraging free preschool, universal preschool, and community colleges like it's free in New Jersey. So I think that education is a huge piece to engage that youth, that opportunity youth that you speak of. You know, we do lots of internships and try to engage those kids in coming into our environment, because not only are we healthcare, but we're also a robust IT department, a business office, and accounting department. You know, we're a community within ourselves across our locations. So the opportunity to get them engaged and mentor them with a lot of millennials that work for us, they're closer to their world than I am, I think are all things we can do. But it's a huge lift. That number always worries me tremendously, that they aren't working and they're not in school. Yeah.
And the cost of health will be borne upon the employers and the health providers. Any special programs going out at the tribe to address the youth and the mental state and engagement?
Yeah, that is a really big challenge, and I think part of the challenge is their attention. You know, trying to keep their attention. And we see that because even when they are employed, the turnover rate is high. You know, they don't stay employed very long, or they don't stay in school very long. They just turn over. And so what we're looking at is skill training and workforce development and things that they can do with their hands, and you know, some of those types of training, because it seems to engage them more than sitting in a class and, you know, taking college courses and giving them other alternatives. So we really have been investing in workforce development and looking at alternatives that will keep them moving and keep them engaged and keep them, you know, more active. But it's been tough because, you know, there's a lot of opportunities out there, and part of it is I think just has to be with that different generation of keeping them engaged.
I'm so glad you said workforce development, because really, as a community, that is what I think our biggest task is going to be. The whole skill set is changing very, very quickly. We've got about 5, and I know that you're also focusing on entrepreneurial development. So I really believe that individuals will need to create their own pathways, and they will, across the whole spectrum, whether you're 65 years old. We have 4 generations in the workforce. First time, right? 4 generations in the workforce. And so if you're a 65-year-old and wants to still be marketable, you need to go ahead and, you know, shine up those skills, right? Teens, youth, engagement, anything you'd like to add from a physician standpoint? Are you working with any in the office, or what are you seeing?
No. I'm an adult oncologist, and you know, so I don't have too much to say on teens for engagement, but I do think to transition it to a patient population that I do take care of is that our elderly are suffering as well. It's a very isolating experience, what we've all been through, but elderly patients in particular have been even more isolated. As you're saying, you know, patients in nursing homes with no visitors. You know, in my career field, we have patients coming in experiencing some of the most challenging times of their life alone. And I think the greater sense of community and support that we can create for everybody, that as you mentioned, even if we're not family, we're still there to support them. And just being aware that that the whole population is suffering from isolation. As you mentioned, we have a problem with obesity from the beginning. Now, many people have used COVID as a avenue to stop taking care of themselves. As we get isolated, we get depressed, we don't have our community
to support us. We're not able to go to fitness classes with our friends. And gradually over the course of the last year, we've become more and more unhealthy. And so just coming together as a group, supporting each other, encouraging each other to stay as active and healthy as possible, it builds. You know, you start by going for a walk, and then you end up being able to get out and apply for a job, you know? So I think just creating a environment of support for everybody and realizing that, you know, we all need to band together.
I think that when you look at a community and you look at the status of health of their youth and their seniors, it's very indicative of whether or not that community is working collaboratively together or not. I think that there's huge opportunity to connect teens and seniors. I've seen it firsthand, and I get goosebumps because it is just such an easy, right in front of our face type of solution that I think that we can go ahead and talk about. What about Casa de los Luz? Any thoughts towards youth? I mean, are people, what would you like to say on the topic?
So I think that, you know, we always talk at Casa de la Luz about taking the stigma out of death, having the conversation about death. But this is a great opportunity to take the stigma out of talking about mental health or depression or anxiety. So partnering with our peers and going across industries to open up opportunities and remove the stigma of depression and anxiety. I have a 16-year-old, and she is much more in tune to diversity and culture than I am, though I think I'm pretty progressive. But her vision and light is so different than what I see at my young age. So tapping into those avenues and opening up opportunities, like I would say 3 years ago, bringing teenagers into an environment with bereavement and death and having those conversations. When I was in acute care, I would have been like, don't do that. Like, that's depressing. But really starting to bridge and having conversations, taking the stigma out of sad topics or depression or anxiety, and partnering across the community of industries to open opportunities, to open up conversations, I think is key.
I've got the timekeeper over here, and I think we've got 90 seconds left, right? So looking forward, right? Bouncing forward, we're coming out of this. Okay, we're here, which is so awesome. Nancy, opportunity, excitement, kind of final words as we lean forward here.
I think our team is in a state of excitement about the future because we've come through this gracefully. Everybody has, I have my outdoor voice on, everybody has done well. We've been able to support our workforce and our patients. I think we're looking forward to, I hate to say the word, more data analytics and technology to be able to help us sort through the patients who need the most help. And, you know, to piggyback on Piper's comment, we have a full-time nurse now who has those conversations about advanced directives with patients across the lifespan and their families. Difficult conversations. And then we hope to live in a world where it's okay to say, I'm depressed or I'm worried about my child. They've been talking about this, that, or the other. That we're all human beings. We need tune-ups across the lifespan. And that's what mental health is about. And I think the pandemic has really showed us, you know, that path forward. Thank you.
Agree. Minnie?
Well, I think that, yeah, it's been a long year, but, you know, it just shows again how we just continue to move forward and we respect everything that has happened, and it just is that wake-up call of how you have to appreciate everyone and everything, and again, appreciate and take care of our environment and do things different and do things better and continue to, you know, just respect life and do things the best that you can every day when you show up to work, and take care of your elders and take care of your family and really take care of the community. And for us, that's really what it's been all about. And even the bigger community, everyone that we work with, everything that we do, it just really has been an opportunity to shake it up and and think about who we are as people and remind us of who we are as people and why we do what we do. You know, we have ceremony every year, and we have different ceremonies for different reasons throughout the year. And we know we have them, and we have them, people pray for different reasons, but this was another reason for us to realize why we do what we do. And so it just was shake it up again and remind us of why we're here and why we do what we do.
Thank you. Sienna?
Yeah, I think that was the best comment. This year has reminded us of who we are and why we do what we do. And remembering that if we all work together, we can achieve anything. And I really think that, you know, we all saw that as all of our healthcare workers coming together in the beginning of the pandemic with, you know, minimal support, and everybody banded together to do what we do. And staying adaptable and working as a team, we can accomplish anything. And I think that's what this year has shown me.
Piper?
So I would say I hope and I look forward to learning from this last year and moving forward. So all of the great and nimble things that we did, and all the things that we're like, well, let's try this, let's do that, let's be that innovative, you know, boots on the ground, root individuals and leaders. I hope that we see that moving forward, so we don't move into our 8 to 5s and go back to a system that wasn't working. I hope that we continue to partner across industries, the healthcare continuum, to serve our community, because we learned a lot of great things in the last year. So how do we embrace those and continue?
Well, I wish we could open up for questions, but do we have time for questions? Oh, wonderful. So about 3 minutes, 5 minutes? What's our question? 10 whole minutes for questions. Let's get comfortable. Okay, so my takeaway was really own your own health now. Be healthy, just like you have to put your face mask on in the plane and take care of yourself, so that you can take care of those around you. Be a force for help. I'll just kind of say my little tag there. But let's go ahead and open it up. We've touched upon many things, telehealth and teen and behavioral health and, you know, COVID. Anybody have any comments, questions? And I've got a couple prepared just in case, but come on now. Yes, Carla.
I think I'm loud enough where I need a microphone. But first of all, my appreciation for you all touching on the technology gap, because I think that's something that a lot of people didn't notice, so I appreciate that. But with that said, I'm curious, how are you all moving forward? Are you planning to continue to have telehealth available? Are you planning, we talked about the hours, right? But is that still going to be an option for patients, for all of you?
Yes, we'll continue to offer telehealth. You know, we're also really fortunate to have a foundation. We have had a lot of donors make contributions that we've been able to use for enabling technology for some of our patients who need it. So it's been, you know, great to have that generosity to support that. And then our partnership with various businesses in town to improve Wi-Fi and broadband access. There's been a lot of FCC money to come through. So I think we're all recognizing technology is here. People who want it, let's be sure we create equality around all that and inclusion for everybody who wants to participate.
And we did use our CARES Act money to have broadband access in all the homes on the reservation and to other people that needed it. And we also, you know, addressed that with our community health reps and also social services on how do we need to help those people that don't know how to use technology. So yeah, for some people it did work, and it was just a matter of releasing that frustration and helping them work through it. But again, some people prefer to be there on site, but in some cases it just wasn't an option. So, but it was something we needed to know and address.
Next.
Can I ask?
Of course you can.
Sorry, I tend to do that sometimes. My follow-up actually with regards to that, because there is going to be a modified approach to how we deliver health, how is this impacting your workforce as far as customer service? And more importantly, how did you see, or did you see an impact in your workforce? Okay, I'm huge on customer service, and I know that we're all frustrated with the pandemic, and I know that a lot of times when you call somewhere or when you engage with somebody, they're dealing with those technology limitations. So their customer service approach is not always pristine for what the organization may want it to be. How are you all experiencing that, and how are you addressing it as physicians, as organizations, and how do you plan to do that moving forward?
I mean, I can start because we have this ridiculously large call center that takes about 75,000 calls a month. So I'm always one that's saying, why are all those people calling? Why can they not get on the portal and make their own appointment? Why are they calling? And particularly because it's, because that department's always coming to me saying, we need to hire 10 more people. And I'm like, why? But we have lots of people that they prefer that. They like to talk to the reps that they know. Many of them know our frequent callers. I think in part, some of that long calls, frequent calls, is addressing isolation and loneliness, right? And behavioral health pieces. So we continue to have that big call center. During the pandemic, their calls skyrocketed. Our triage nurses took 3 times as many calls just in reassuring people, giving them facts versus what they might be reading wherever they were reading, social media or hearing from a politician or whatever might be going on. So I think that we struggle with customer service even in non-pandemic times, and that we're talking to a diverse population. We're talking to people who are worried and scared, so they're regressing developmentally at that moment in time in how they communicate. And it's continual curriculum and education that we're always doing. And I always start off, because sometimes I get a patient who calls me who's very upset about how they feel they were treated or not treated. And I always start off with, that is not the experience I wanted you to have. And right away, they're in a place of, let's talk about how we can improve. So I think that's like a huge ongoing issue probably for everyone in healthcare, because we're dealing with people who are worried and frightened many times, and there's also the lack of knowledge. We get patients who call. We had a patient one time, this is a funny story. We had a patient who was refusing to have her colposcopy because she understood the provider to say she needed a colonoscopy, and she wasn't willing to participate in the prep for that. So this was a series of phone calls back and forth. So you realize the difference around literacy, health literacy, and all the education that has to go around in healthcare as part of customer service.
So I think the biggest thing, I'm so sorry, is tapping into your staff. So customer service is really starting with them. So what we've seen is our staff is tired. They tend to be compassionate people, but they're missing that human contact, that human touch, that ability. Like if they keep saying, can we just get together? Do we have to keep doing interdisciplinary team on Zoom? So tapping into them and knowing where they are in their space. And then education on how to answer the phone politely and all that kind of stuff. But if you have a staff that is disengaging because of the pandemic, or that they're trying to homeschool their children, then you're going to decrease your customer service. So really tapping into, where are they? Are they doing okay? Do they need, we had multiple, of course over Zoom, but check-ins. Come talk to us. Zoom in with our bereavement counselors. How are you doing? And knowing where they are. I do think that telehealth and our ability to serve will continue. We used our foundation a lot for iPads and phones and connections, not so much for setting up internet services. So that's big, but really just being able to make sure that our staff is as supportive as they need to be as well.
Yeah, just building onto that, my experience with telehealth, particularly in the beginning, the frustration and the less than excellent customer service was usually because it's very difficult to communicate how to utilize telehealth over the telephone. So the MAs would be calling the patients, trying to help them set up the system, and then we didn't even know how to really use the system. And so something that I've done now is most of the telehealth is follow-up at this point for us. So if the patient is open to telehealth, we try to have them download the app and learn how to use it briefly while they're in the clinic so that that frustration is minimized, and then my staff on the other end is able to better communicate with the patient how to manage that, and that's been.
I come from the call center space also, and I'm also constantly prospecting, and I'm constantly on websites. And one thing, and you mentioned, why do they have to call, right? I cannot stand it when a company does not put a phone number on their website. I hope that that doesn't go away, and when you are calling, I hope that somebody answers inside of 5 minutes, because it's so frustrating to be in the world of technology and connectivity and still have that gap. I get the fact that FTE costs are expensive and we can go ahead and route that to a chat bot and just go ahead and put them in the deal and just go, right? But it brings to mind a conversation I had with a 16-year-old. He was in Greater Hattiesburg, Mississippi, and he serves on the Mayor's Youth Council. Health is not funded in schools, okay? If your PE teacher isn't out there writing grants, you probably are not getting funded for health resources in school, which is so sad, right? But he said something, I was just flipping through a magazine that I used to publish. He's like, God, I really love that. You know, we really lack quality media to teach us about health. From the mouth of a 16-year-old who is sitting on a mayor's council in Greater Hattiesburg, Mississippi, one of the most, unhealthy places in the country. And so I just wanted to recognize and remind that multimedia messaging to increase health literacy for everybody equitably, to me, is so important. Yeah. Anyways, good question. Yes.
Thank you all for being here. I'm Luis with Grand Canyon University. One of the big questions I have is, what can we do as community members, as business partners, as different agents of the community, help support all of your initiatives and help support what you do for the community in order to be better partners and better members of society here in Southern Arizona?
Start with Nancy.
I think we've met before. Nice to see you. I kept going, I know that guy. Who is that guy? Yeah. So I think that right now we're finding, because you're from at the education field, we're finding lots of people wanting to go into healthcare. We've had people leave, but we also have a lot of our workforce who are on the front lines who are interested in pursuing a nursing degree, particularly. We're working on a workforce development partnership right now where we have frontline receptionists, farm techs that are going to start May 10th becoming medical assistants in partnership with Pima Community College. So that's a partnership we have going on. And then we have a lot of other staff from LPNs that want to become RNs. We have some physicians right now that started off, grew up in Tucson, worked for us as MAs, and they're physicians for us now. So I think we want to be able to, for our workforce, they want to see their career through our eyes. What do we think they're capable of doing? So I think that's always a great partnership you bring. But, we have so many people involved with us, like we have the Vecinos, the under 40 group, fabulous Vecinos that help us, pay for any of our programs where people don't have funds. They're very involved with our mission and vision. I think all of us can recognize what I call the three-legged stool. Like when I'm working with SLC, they do a lot of policy and talk about economic things and education things. And I've been telling them as a board member, healthcare is the third leg of your stool. If people don't have access to healthcare and we aren't all pushing the community up in that area, they're not going to be able to get a good education. They're not going to be able to be employed. They're going to be one of those opportunity youth that you were talking about earlier. So I think that all of us need to recognize the model for a healthy community and participate in that whatever way we are drawn from our heart and our brains. So, yeah.
Adopt a school.
Yeah.
Another-
3 words.
Excellent.
That's a good idea. I know, thank you for the question. I know that we have quite a few students in our workforce that are attending GCU. And so I don't know of anything offhand, but I think one idea is just even working with our employees on, in-service training and thinking about even what you mentioned with the customer service, because that always comes up. One of the biggest challenges that we dealt with in the very beginning was, are we closed? Are we not closed? And I kept saying, we're not closed. It's like everybody's working from home, but we're open, and it was just getting that mindset from our employees that we're remote work, because people were like, are you closed? You're closed. You're not doing this. We're open. But it was just that technology, fax it in, email it in, that kind of stuff, and it's still, people are old school. I mean, sometimes people can be like way, ahead of the curve, and then other people have been working. We have employees that have been working with us for 20 plus years, and they are old school. And they're not going to change, and we love them. And then we have other employees that are, working with us 20 years, and they are high tech. They want to do things in like high tech. So it's that balance, but having, just training and things or information that you can offer, that'd be great.
I have a final question, and I'm gonna oh, Laura, you had a question. Yes.
So we've talked about, or you guys have talked about the healthcare provider shortages that we're going through, and it is a nationwide crisis. If you guys had a magic wand, how would you solve that problem?
I don't know if it's a magic wand, but I don't know if you all are familiar with the Arizona Health Education Programs. It's a federally funded program. It's set up in regions across Arizona. And the whole intent of those programs is to develop the healthcare workforce, right? So there are 3 parts of that program. The first is in the schools, where you're out in the high schools, you're doing health career clubs, you're taking them to U of A for summer science camp, you're doing all that work, and then you're following them through school. So let's say they're pre-med, they're in undergrad. During the summer, I would reach out to them as a Tucsonan and say, hey, we got a job for you this summer while you're home. Oh, you're invited to our holiday party. We're building those relationships. So that's the first piece. The second piece of that federal program, it's also matched with Arizona lottery dollars here in Arizona. The second part is recruitment and retention. More of setting up all the clinical rotations for people. Like at El Rio, we're a teaching health center, so we have probably about 450 undergraduate interested public health nursing students who come and hang with us. We also have a nurse practitioner residency program, a family medicine residency program, 2 dental residency programs, and a clinical pharmacy program. So that's the recruitment of the workforce. Where people do their residency, that last part of their clinical education, they tend to live there or stay there. So I get people who call me from Massachusetts who go, I would like to do a rotation in the winter in Arizona. I go, are you from Arizona? Do you have family in Arizona? You don't? Probably down my list of priorities, because they're not going to stay here most likely. So I'm looking for the Arizona people to recruit, to live here and work in Arizona. The third part of that program is the retention. So it's the success of the AHEC program is measured on how many Arizona kids and adults we recruit to stay and serve here in Arizona. So I think that's our workforce piece. And just to give you an example, Safford, Arizona, have you been to Safford? Little town of Safford, right? I was doing some work with them, and they had this orthopedic surgeon who trained at Mayo, did surgery all over the world, like this big all-star. I'm like, ¿Por qué está aquí? What is going on here? Why is he here? They go, well, he's from Safford. He grew up in Safford. They kept in touch with him throughout his undergraduate career. He was back at the holidays. And, they have an orthopedic surgeon that probably has better outcomes insurgents than urban areas. He's working with the same staff every day. So, you know, that's how you build your healthcare workforce. You got to be about it every day. You got to engage in that. Right now, I am tracking a young man from Douglas who he came and did a rotation with us. He got engaged with one of our practitioners who's double boarded in psychiatry and family medicine. They formed a relationship. He's in the same residency program where our physician went. So he's finishing his 3rd year, be coming back home to the mothership here to practice in Tucson, right? So that's how it's done. It's about relationships back to, you know, where we started, I think.
I think that that's a perfect note to just let's go down the line. My last question is, do you truly believe that Pima County in southern Arizona, but more specifically Pima County, do you think we have what it takes to be the healthiest community in the country? Why or why not? And we've got 90 seconds. So within a minute, do you think we have what it takes? Where do you feel like we stand? Do we have what it takes to be the healthiest community model to brag about in the country? Why or why not?
Well, since I've lived here since 1982, when I was a very young girl, I can tell you that I have been through public health in this community for many, many moons. I have watched us get these huge grants for like 15.7 million come in to create healthy community. I look at when the grant's done, I don't see sustainable outcomes from that. I think as a community, we are super good at getting together, looking at data, putting together strategy, and leaving the room. The hard work is out with your boots on the ground, in the neighborhoods, in the community, teaching, helping, and leading. So when I think about funding, I'm like, oh, we got to get funding out to the promotores, I got to get funding out to the people who are actually doing the important work that will embed those healthy behaviors in the population.
So we're good at getting grants, but not necessarily good at
we're good at
improving
planning.
outcomes.
We're really good at planning.
Got it.
Yeah.
Okay, Minnie.
My answer is yes. I was born and raised here, and I know that we can do it. And I know we can do it because we have the environment to do this. This is the perfect place to live. The weather here, how can you beat this? How can you beat this? You know, 365. And so people can go out and walk 365 at minimum if you can walk. If you can go out in a wheelchair and somebody can take you out. You know, this is 365. You know, and we are in the perfect environment to go out. The disconnect is transportation. We need more trails. We need more bike routes. We need safe access to these places. We need to make sure that we are connected as a community. That is where there is, you know, the lack of the connection throughout this whole area. You know, everything needs to be connected, but we are in the perfect environment here. We need to make sure that it's safe. We need to make sure the air is clean. We need to make sure the water is clean. We need to make sure the infrastructure is here. The environment, look outside. We've got it. So yes, we can be the best place. To your question, if I can answer it really quick, if I had the magic wands, look, I would hire these doctors, these nurses, all of these healthcare providers. What they would do is just hire them or go to school only to focus on what they do to help us heal our people. And when they work for us, you don't have to worry about your student loan. You don't have to worry about, you know, the business part of your medical care. You don't have to worry about all that business. Your job is to heal your patients, our community. That's it. Don't stress about cutting costs in the insurance company. Don't stress about how I'm gonna make this work and how I'm gonna, you know, cut 15 minutes here because I gotta see the next patient, and don't worry about this and that, you know, because I'm working with the magic wand here. You know, we have to figure out how we take care of patients and how we heal patients, and let the other part of the system worry about the cost and all that stuff. But that's why people don't want to go into the medical care You know, because they end up with these insurances, the insurance company, and malpractice, and all this other stuff that gets in the way of what they really went to school for, of healing.
But they work at community
But
health
I'm working
centers.
with a magic wand.
No, because we
They're
have
You're
loan
right.
forgiveness, right?
Right.
So
We
our
have all that.
providers,
But with
all
the
those-
magic wand, we don't need any of that. We got the magic
they
wand.
won't have.
Yeah, we have a magic wand. We
I
got a
thought I
magic
already
wand.
had that
No,
magic
we have
wand.
a magic wand.
Are you saying that El Rio offers loan forgiveness?
Yes,
Yeah,
they do.
we have.
They do.
That's
The
a beautiful
community
thing.
qualified
All of
center.
our
It's good.
providers have their medical loans forgiven for service. Yeah.
Wow.
We got that wand.
But this
Have
is
the
a
other
perfect
one.
place to live.
But counter to that, we did win the award for best urban loop in the country, so we're already there, right? Where are you from? Have you been in Tucson, and do you think we have what it takes to be the best in the country?
So I'm very new to Tucson. I moved here in January, and I moved here because I think Tucson is a fabulous place to be fit and healthy. The weather is beautiful. There's an environment of happiness here, which I've traveled. I was in the Air Force. I traveled all over the country. I've lived in many different places, and Tucson is just a peaceful, happy place to be. But wellness and everything is dependent on good leadership. And, you know, we are walking billboards for what we want people to achieve. And if we want a well community, we need to be well ourselves. And so I think I think that's the key. Lead by example, share your experiences, and if everybody pulls together and there's excellent leadership, gradually the community will become healthier. And that's all I have to say.
Well, welcome to Tucson. Piper, what do you think?
So I think we have a lot of great trails, the loops. We have a lot of great infrastructure already in place. Our biggest thing, I think, is education. Getting into the schools and teaching about physical education. Some of us have gained some weight through the pandemic, so we just will ignore that. But also access to care. So reaching out to those communities that need better access to care. Telehealth can help with those some, but again, it's those touch points. So I think working on access to care and education at an early age, I think could drive us to being the best in the country. Because we've got some great golf courses, and anyways.
Will you let me say one more thing,
Sure,
Madam,
of
Madam
course.
Moderator? You know, I'm frequently struck because we have about 1,500 employees. So I'm always thinking about employees. I have a lot of single moms that work for us. They've got their kids. Here's their day. They get up in the morning. We got to get breakfast. We got to get ready for school. I got to take my kids to school, drop the kids off at school or childcare, wherever's going. Then I have to come to work, find something for me to eat, take care of my patients all day. Maybe I take a break for lunch, eat something. Then I get off work, I pick up my kids, we got to go home and do homework and have dinner and prepare for the next day, and I am exhausted. So when am I going to so I encourage you all as employers to think about, how do we help our single parents or even, just our families manage all this stuff, come to work, do what we want them to do, and have that energy. I have 5 children, the youngest is 26 now. I don't know when people find time for self. So I would just leave that with everybody.
Well, Mother's Day is coming up, so we'll just
I always wanted a nap on Mother's Day.
Right. So I do believe that Tucson has what it takes. We are a very, very, very diverse community. We are binational. We are big enough but small enough to collaborate, and with all of the communities that I've been talking to, we come very, very kind of full force. So I'm going to go on record saying we do have what it takes. So with that being said, I'll go ahead and wrap up the panel. Thank you so much. And Isabel, I would hand it back to you. Thank you.
Thank you. Can we give a big hand to this panel? I was furiously taking notes. It was just such a wonderful discussion, and thank you. Before they came, they were all like, "Do you have questions?" And I said, "Yes, but we'd really just like you to share and tell us what you think about this overarching topic." And I just couldn't tell you how wonderful that was. Do you agree? Do you agree? Yes. Thank you. Everybody spoke from the heart, from their passion, and I just want to recap a couple of things for you guys. We started with Dr. Carmona, And he really, I wrote down two things. I wrote down accelerator driving innovation. He really highlighted that despite what we're going through, we've been accelerated. And it took me literally back to last year. And I'm just going to share this quick little story if you'll humor me. And we were at the chamber, and everything went dark, as you guys know. And I was sitting there with my team. We were literally in the conference room, and I said, okay, so we can't talk to anybody. We can't do anything. We need to figure out how to serve our members and community during this time. We need to figure it out. Because the truth was, the phones didn't stop ringing, right? From 7 a.m. to 7 at night, we were taking calls, people asking for help. And even though we're a chamber, the truth is we serve our community. So it didn't matter what the need was, they called us. And and that goes back to what Carla said about our healthcare heroes, our frontline workers. You just served. And again, we're so grateful for that. We wouldn't be here without the other thing that he said that made me think was, it's a community problem and it requires community solutions. And so that's the other reason why we're conducting these roundtables. Because as a team, as we came out of last year, we pivoted, we adjusted. We engaged with our community in streaming and tried to stay connected, because that is a fear, right? The isolation and all the other points that you brought up today are true fears. We are still trying to figure out how to interact with each other this morning. It was so fun, but at the same time, we're like, it looked like we were doing a dance, trying to figure out how to connect. But when he said that again, sitting together as a group, as we looked at this year, at 2021, we said, we want to engage and create a place where people can come and talk, share important information, ideas, and continue to challenge us to accelerate, to look at how we innovate and learn. Because that was the other key opportunity I think that we saw last year for ourselves as an organization, but anyone we engaged with and worked to collaborate, is that this is an opportunity to learn. As challenging as it is, it's an opportunity for us to learn. And so we want to thank you, because the gift that you gave us today is learning a little bit more and stepping into your worlds. So that was lovely. Thank you. And like you, I get And the last thing I would like to say is just really quick, you know what? Last year, it was okay that some things collapsed. It was okay. Because again, it forced us to look for the lesson. And that's a key part of, I think, being in community anywhere, right? Is that we fail every day. Guess what? We face planted as an entire world, right? So the challenge now is, what are we gonna embrace and learn? What are we gonna take back? And your question was wonderful. How do we all start stepping in and doing our part? Because that was the challenge. Not worrying about who is afraid or who doesn't want to, but more, let's just turn the mirror in and do our part. If more of us do that, we'll start to lead in a different direction, as Dr. Cooper said. So thank you so much for this opportunity to be with everyone. Again, I echo Carla's words this morning. Let's give a big hand to our healthcare workers and frontline workers who have been with us. And last but not least, I would be remiss if I didn't thank all the individuals who made today possible, with our members, our corporate sponsors, our media partners, all of the individuals that help us bring this messaging to you. Thank you all. Give yourselves a hand for a great day.
Should we get tighter?
You